Hi guys, so I just wanted to do a video to provide some information on what sciatica is and how we may be able to manage the associated symptoms ourselves by ticking a few boxes in a sort of trial and error sort of way. Lots of boxes to tick potentially, but we've got limited access to therapists, so it's a good time to try. So sciatica is an umbrella term often used to describe the various symptoms experienced as a result of irritations to the lumbar nerve root or a branch of it. Typically, a telltale sign is pain below the knee, but this isn't foolproof by any means. Symptoms of sciatica are often consistent with a peripheral neuropathy and commonly present as numbness, tingling, burning, typical nerve-related symptoms that you may find. You'll also find that you find it difficult to gesture to the area. It'll be a vague gesture towards an area rather than a specific pinpoint. So true sciatica is an irritation at the lumbar spine as a result of structural changes, for example a disc herniation, which as I understand is soul destroying in terms of pain and pretty constant. However, there are several other way more common causes of sciatica type pain and these symptoms. Does it matter that they're all called sciatica? Perhaps not. I mean, if the therapist that you're seeing, or if you are a therapist, if you're aware of the red flag symptoms of serious pathology, then you know you're in a safe place. And also be aware that there's lots of different issues that can cause these symptoms. So one of the most common causes of sciatica, certainly that I've come across, is Piriformis syndrome. So this is contentious. People will argue the toss. To be honest, whenever I've treated Piriformis, I've seen some benefits, not all the time, but I do think it's a go-to. So Piriformis is a muscle that lies deep in the glutes and crucially lies over the top of the sciatic nerve. So if it gets short and tight, it can impinge on the nerve, thus creating symptoms along the nerve root, so buttock, back of the thigh, knee, and sometimes below. Interestingly, in a small proportion of the population, the sciatic nerve actually penetrates, the piriformis goes through it, so they're obviously slightly more susceptible to those symptoms. So we need to access it. If we're going to do some self-release, we need to know where it is. The best place to start is at the greater trochanter of the femur, which is quite simply the bony bit on the outside, and then you need to look for the lateral border of the sacrum, and they go in like a T. So if you do a horizontal line from the bony bit on the outside of your thigh, and then the lateral border of the sacrum, probably that angle, you're looking at a T, and it's this line of the T, so the vertical, is your piriformis. More often than not, you'll hit it and you'll feel it. It's almost horizontal, and you'll feel it. You can flick over it. But yeah, let's look at the anatomy to make that a little bit clearer, and then we'll look at some ways that we can release that and potentially ease off some of the irritating symptoms that we've discussed.
Okay, so firstly, let's locate the greater trochanter of the femur, which is the bony prominence on the outside. In order to do so, we're going to strip back some of this anatomy. So let's clear the iliotibial band, 2 sections, and we'll get rid of vastus lateralis, so the quad on the outside of the thigh, gluteus maximus, gluteus medius, gluteus minimus. And now we're going to look to highlight the femur itself. There it is. And then as we rotate that, we'll be able to see that how it just protrudes, the head or the greater trochanter of the femur protrudes on the outside of the hip. And then we'll rotate that back. And then if we just strip some of the ligaments off the back of the sacrum here, we'll just expose the bone, and we will be able to just show you the T that I was referring to before. So let's just annotate the side of this. Okay, so we're looking to find the lateral border, the sacrum there, then follow the track of piriformis, and that creates your T. So you're going from the head of the femur, so the greater trochanter, to the lateral border of the sacrum, thus creating your T. Now, what we'll do, crucially, we need to highlight the piriformis itself. So we're going to zoom in a little bit here, and there is your piriformis. Okay, so again we're going from the greater trochanter of the head of the femur, and we're going to the lateral border of the sacrum. Now, the whole crux of this is about sciatica, and for the more clued in of us, you will have already noted the sciatic nerve. So there's the piriformis, and that goldy yellow rope appears to go underneath the piriformis is the sciatic nerve. There it is. So there you can see that when the piriformis, here it is, gets tight, it'll shorten and it will impinge, or could impinge, on the sciatic nerve. Now, there's key information here is that actually if the piriformis is shortening and getting tight and impinges on the sciatic nerve, or is dysfunctional in that way, it could also have trigger points in it. So a short, tight piriformis may actually refer in a trigger point fashion down that same route without actually impinging on the nerve. So that's where it sort of muddies the water a little bit. But it actually emphasizes the point that piriformis is worth dealing with. So we have highlighted the origin and insertion of piriformis, and also where the sciatic nerve lies. Okay, so with foam rolling, I usually start with this just to get the tissues warmed up. So you're trying to access the deeper structures, so you're warming up gluteus maximus, medius, just softening that tissue to get down to the muscles such as piriformis. The deeper you go, the slower you go, so that's just respecting the tissue, and you can control depth just with your elbow, just lifting off the pressure. You can play around with the depth, you can make sure you cover all the muscle all the way up to the pelvic rim. You can change the rotation as such, which can help. It's individual difference, but we're just looking to get everything warmed up. Okay, so with the trigger ball, similar to the foam roller, there are no real rules with the trigger ball. You're just looking to respect the tissue. Similar to the foam roller, you're just allowing that pressure just to sink slowly and respectfully into the tissues, without forcing the depth. And as I say, no rules. If you find that there's a deep ache or a trigger point that refers elsewhere, then stick with it, allow it to settle, and you can use abduction of the hip, medial lateral rotation, and just allow that tension just to dissipate and move to a new spot. Just be careful of referral from the sciatic nerve. Okay, so with the stretching, we're looking to laterally rotate that right leg, so that's the leg we're going to be stretching. And as you can see with the left leg, we are just shifting that heel up towards the bum just to intensify that stretch. To intensify it further, you can hook your hands behind that left leg and hook that knee up towards you. Again, remembering it's the right leg that we're stretching here, so that right piriformis. And you can intensify that even further. I always recommend doing both sides if you can. So I really do tend to feel the benefits on these stretches, and hold them for as long as is comfortable. We don't want to be in awkward, crampy positions. Again, remembering the leg we're stretching is the leg that's laterally rotated, and the one that we're hoisting up towards us is just assisting us in that depth of stretch. And again, you can intensify that stretch if you want to. So this next stretch is slightly more generic glute stretch. We are getting a bit of everything, and you can hold the knee there, or you can use this as a muscle energy technique. So you would gently push your knee outwards into your hands, and your hands would resist the pressure. Just 10% of your full contraction. Hold that for 10 seconds, and then once the 10 seconds is over, you can relax, and you will be able just to hug that knee in a little bit closer to you. That will intensify the stretch a little bit, and you can repeat that until you can't go any further. And again, I would recommend working both sides. So again, really gently pushing that knee outwards into the hands whilst they resist you for 10 seconds, just 10% of your full contraction, and relax and hug that in a little bit closer, and that will intensify that. So that's muscle energy technique. And now if you can get a little bit further, hook that leg all the way round. We're going to get a bit of glute, bit of everything really. All the lateral rotators are going to stretch on that one, even a bit of iliotibial band and lower back. So if you can integrate a little bit of rotation as well, that'll definitely help. And to reiterate, working both sides would be advisable. Here you can see just that same stretch from a different angle, just to give you a bit more idea what my legs are doing.